2NURFM, a broadcast service of the University of Newcastle.
There's always a study of some way, shape or form happening, and a lot of time, well, the university needs your help to make these studies happen. It's great to have Rohith in the studio again. It's been a couple of months since you paid a visit to us last time. Rohith, good morning. You've got an interesting study underway in diabetes.
Yep. Thanks, Todd. First, I think you might have listened to me a couple of months back. I wanted to really thank you first by taking this opportunity, that for whatever the support you have provided until now. And we have been halfway through the study, which you are well known with curcumin, with or without fish oil, for prevention of type 2 diabetes. So as we came to know from the previous guys that you might not be aware of your recent glucose levels. So what we are trying to do is we have a 2-minute questionnaire which is supported by Australian government, Australian type 2 diabetes risk assessment tool. So it just takes 2 minutes of your time to know your risk. And if you get a score of 12 or more from this risk, then you can contact us at 49215636 to determine your score, and you will have an opportunity to participate in the study.
Rohith, is it a concern to you? Are you finding more and more people are walking around, they're living with diabetes or very close to it, and they've got no idea that that's the situation?
Yeah, that's what we have heard, that pre-diabetes, actually most of them doesn't know, but 1 in 4 has pre-diabetes conditions walking around. So it's like every 5 minutes there are a lot of Australians developing diabetes. So it's in such a serious condition. So what we are trying to do, without taking their blood, we use this questionnaire to see whether they are at a risk of diabetes, and then we give them a chance to participate in our study to less their risk of diabetes.
That's really interesting, because people are very time poor, aren't they?
Yeah.
And the opportunity to come and give blood, and there might be people who are a little bit reticent to do that.
Yeah.
Have you found, when it comes to diabetes, I would imagine with any disease or condition of this kind, the sooner you know about it, the better. And if you can nip it in the bud before it happens.
That's exactly right. That's why we are targeting the pre-diabetes population. So this population are at a slight risk of developing diabetes. So we want to exactly act at this stage so that they won't go into the type 2 diabetic stage and use the medications. So it's all about like controlling at the stage, right stage, where they have absolute chance of preventing it.
So lifestyle changes before you have to go to a medicated change.
Yeah, it's like lifestyle changes are always an important factor, but in this study we are giving curcumin along with the fish oil or without fish oil to see whether we can manage the risk factors like high blood glucose levels, high cholesterol, or all these things, inflammation.
Any particular age group that you're leaning towards, or just 18 and up?
Yeah, it's from age group from 30 years to 70 years, because most people at a risk of pre-diabetes are above 30. So that's what in the question is. The first age group is under 35 has 0 points, and above 35 has 2, 4 until it increases with age. So that's what this question is say. And then your gender is important, like for determining. We can't do much with the gender, but it helps you to determine that you are at a more risk of developing diabetes.
Well, there's not a lot you can do about the gender, is there?
Yeah, it's just about like determining the risk. So if we find out that they have more risk, then we give them a chance to participate in the trial and see how they can control the risk.
Excellent, great work.
Yeah.
What was that phone number again, Rohith?
49215636.
Just more amazing work that's happening at the University of Newcastle.
Yeah, it's always amazing and updating every day.
Oh, there's always something happening. Thanks for your time this morning.
Yeah, thank you very much, Todd.
Thank you, Rohith. Well,